All right, let's talk about one of the biggest decisions you'll make for your retirement. If you're getting close to 65, this is for you. We're going to break down your Medicare choices step by step so you can build the right strategy for you. To make sense of it all, you have to understand that Medicare isn't just one plan. Think of it more like a set of building blocks. There are four core parts, and knowing what each one does is the key to everything else. So let's start with Part A. This is your hospital insurance. If you're admitted to the hospital or need skilled nursing or hospice, Part A is what covers you. And for most people, it's premium-free, which is great. But, and this is a big but, it has deductibles, and there's no ceiling on what you might have to pay if you have a really long stay. Keep that in mind. Then you've got Part B. This is your medical insurance. It covers all the day-to-day stuff. You know, your doctor's appointments, outpatient procedures, lab work, things like that. You pay a monthly premium for this, and there's a deductible each year. But the real story with Part B is what happens after you've paid that deductible. That's because once your deductible is met, you're on the hook for 20% of the bill for most services. It doesn't matter if it's a $100 visit or a $100,000 surgery, you pay 20%. And here is the absolute most important thing to understand. That 20% has no limit, no cap, no safety net. This is, without a doubt, the biggest financial risk of just having Original Medicare, and it's the reason the other plans we're about to talk about even exist. So that brings us to Part C, which most people know as Medicare Advantage. Now, this isn't something you add on. It's a totally different path. You're basically choosing a private insurance plan to replace Parts A and B. They bundle everything together, and here's the key. They have an out-of-pocket maximum, so they solve that huge risk we just talked about. And finally, we have Part D. Pretty simple. This is your prescription drug coverage. It's a separate plan that helps pay for your medications. Now, listen up, because the #1 rule of Part D is this. If you don't sign up for it when you're supposed to, you could face a penalty, and that penalty lasts for life. Okay, so now that you know the four building blocks, you've arrived at the exact same place everyone does when they start Medicare. You're at a major fork in the road, and the choice you make right here will shape your healthcare for a long, long time. And here are the two main paths you can take. Path 1 is sticking with the government's original Medicare. That's Parts A and B, and then adding on some extra coverage. Path 2 is going with a private Medicare Advantage plan, or Part C, that bundles it all together. Let's break down each one. So first up, path #1, this is kind of the classic route. You take that foundation of Original Medicare, and then you build on top of it with something called a Medigap plan. A Medigap plan is exactly what it sounds like. It's designed to fill in the financial gaps in Original Medicare. Most importantly, it pays for that unlimited 20% coinsurance we were so worried about. What it doesn't do is cover things like prescription drugs or dental and vision. You'd still need a separate Part D plan for your meds. Okay, everybody, lean in for this part. This might be the most important, time-sensitive slide we look at. The moment you are both 65 and enrolled in Part B, a 6-month clock starts ticking. This is your one-time-only Medigap open enrollment period. During these 6 months, you can get any Medigap plan you want, no questions asked about your health. If you miss this window, an insurance company could deny you coverage later on. It's a huge deal. All right, let's switch gears and look at path #2. This is a totally different way to go. Instead of adding to Original Medicare, you're going with a private plan known as Medicare Advantage. Now, the appeal here is pretty obvious. A lot of these plans have super low or even $0 monthly premiums. They all come with that out-of-pocket maximum for your protection, and they often throw in extra perks that Original Medicare just doesn't cover, like vision, dental, and even gym memberships. But, of course, there are trade-offs. You're usually limited to a network of doctors and hospitals, kind of like an HMO or a PPO. You might need to get permission or prior authorization from the insurance company before you can get certain tests or procedures. And this is a big one. If you start with an Advantage plan and want to switch to Medigap later in life, you might not be able to if your health has changed. So no matter which of those two paths you're leaning towards, there are a couple of universal rules and traps you have to know about. Getting these wrong can be really, really costly. Take a look at this number, 10%. This number is tied to one of the most common and most expensive mistakes people make when they're first signing up for Medicare. Here's the deal. If you're supposed to sign up for Part B and you don't have other health coverage from a job, you get hit with a penalty. For every single year you wait, your monthly premium goes up by 10%. And that penalty isn't just a one-time thing. It sticks with you for life. Okay, let's bust another huge myth. A lot of people think Medicare will cover them if they need to go into a nursing home long term. It won't. Medicare might cover a short, skilled stay after you've been in the hospital, but it does not cover long term custodial care. That's a completely different kind of planning you have to do. Whew, okay, that was a lot of information, I know. So, how do you actually make a choice? Well, it really just comes down to what's most important to you. Let's put it all together in a simple framework. So here it is, side by side. With Original Medicare plus a Medigap plan, you get total freedom to choose your doctors, and your costs are super predictable. But you're going to pay a higher monthly premium for that peace of mind. On the other side, Medicare Advantage gives you lower premiums and those extra benefits, but you're giving up some of that freedom of choice and flexibility down the road. So at the end of the day, it really boils down to this one question. What do you value more? Is it maximum freedom and knowing exactly what your costs will be? Or is it keeping your monthly premiums low and getting those extra perks, even if it means staying within a network? The answer to that question will tell you which path is the right one for you.